The Centers for Medicare and Medicaid Services, or CMS, released the proposed calendar year 2023 Physician Fee Schedule, or PFS rule, recently. This rule would greatly increase access to mental health services, ACOs, or accountable care organizations, cancer screening, and dental care, especially in rural and underserved areas. In this part 2 of 2 video, we will discuss the evaluation and management changes and split shared services. You have to know where you have been to know where you are going, right? The proposed rule for calendar year 2023 PFS is one of several proposed rules that are part of a larger plan by the administration to create a more fair healthcare system with better access, quality, cost, and innovation. CMS is accepting comments on the proposed PFS rule until September 6th. Since 1992, Medicare has used the PFS to pay doctors and other billing professionals for their services. Services from doctors that are paid by the PFS are done in many different places. Medicare pays doctors and other professionals for a single rate for most services given in a doctor's office. This rate is based on all the resources that went into giving the service. Payments are based on how much time and money are usually put into providing the service. Each service, practice expense, and malpractice expense is given a certain number of relative value units, or RVUs. With the help of a conversion factor, these RVUs are turned into payment rates. Geographic adjusters, such as the Geographic Practice Cost Index, are also added to the total RVUs to account for different practice costs in different areas. When figuring out payment rates, an overall payment update that is set by law is taken into account. Now, before I get into what's being proposed, let me say, hey there, and welcome. If you are new here, you don't know me yet. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've served hundreds of students and helped them transform to become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Consider subscribing to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. Oh, and don't forget to hit that bell for notifications of my weekly videos, or as most folks say, smash that bell. As part of their efforts to make evaluation and management, or E&M visits, and related coding guidelines easier to manage, the AMA CPT editorial panel approved new coding and updated guidelines for other E&M services, which go into effect on January 1st, 2023. Similar to what they did in the calendar year 2021 PFS final rule for office and outpatient E&M visits, coding and documentation, they want to make most of these changes to coding and documentation for other E&M visits, which include hospital inpatient, hospital observation, emergency department, nursing facility, home or resident services, and cognitive impairment assessment. And all of this takes place on January 1st, 2023. So changes to the CPT code definitions or revisions to the other E&M code descriptors will be part of this new coding and documentation framework. I will let you know about the AMA's details in the next video, so be on the lookout for that. So the changes include times for a new descriptor where relevant, interpretive guidelines for different levels of medical decision making have been updated, choice of making medical decisions or time to choose code level, except for a few families like emergency department visits and cognitive impairment assessment, which are not time-based services. History and exam are no longer used to figure out the code level. Instead, there will be a requirement for a medically appropriate history and exam. CMS wants to keep the current billing policies for E&Ms in place while they think about possible changes that might be needed in future rulemaking. They also want to come up with Medicare-specific coding for payment of other E&M services that take a long time, like they did in calendar year 2021 for payment of office and outpatient services that take a long time. So let's talk a little bit about the E&M visits that are split or shared. So for calendar year 2023, they want to delay by 1 year, with a few exceptions, the split or shared visits policy that they finalized in calendar year 2022. This policy says a substantive portion is more than half of the total time. So for calendar year 2023, as in calendar year 2022, any of the following things can count as a substantive part of the visit: history, getting a physical examination, making a choice about health care, spending time more than half of the total time spent by the practitioner who bills the visit. Under their plan until calendar year 2024, clinicians who provide split or shared visits will still be able to choose between the history, physical exam, medical decision making, or more than half of the total practitioner time spent to define the substantive portion, instead of using the total practitioner time. I like that change. So you have learned that the 2023 PFS proposed rule has been released, and you have also learned what is being proposed for evaluation and management services and split shared services. And lastly, you have learned that all comments on any part of the proposed PFS rule are being accepted until September 6th. Questions of the day. Did you know that this information was released? And what do you think about the proposals? Do you think they will be helpful in evaluation and management coding? Let me know in the comments below. I would love to hear your thoughts. My final thoughts: these evaluation and management changes have been anticipated since the office and other outpatient evaluation and management services changes in 2021. I am still looking for data on the impact of these changes for providers. I recently had conversations about medical necessity and the new evaluation and management changes. There is still a potential for upcoding and medical necessity problems. I will put together a video about that conversation real soon. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos and check this out. Are you interested in medical coding, but not sure where to start and scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder. If you liked the video, don't forget to let me know by hitting the thumbs up, smashing that subscribe button, and the notification bell so you are informed every week when I upload new content. You know what? I love hearing from you. So let me know you were here by providing a comment or asking a question or just saying hi. You could also give me a little love by sharing this video on your social media platforms. So tag me in your video share at PRN Coding EDU. Let's stay connected and connect others. Well, once again, you have stayed until the end. And let me know in the comments where you are checking in from. And let me know if you have specific questions or items you would like to see discussed on our channel. If you want to learn more about the wonderful world of health information, medical coding, and/or compliance, then watch one of these videos. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care, and thanks so much for watching.